thank you for joining us on MD Newsline. It's a pleasure to have you, and thank you so much for just kind of taking the time to come and chat with us. Please introduce yourself to our audience.
Great, thanks for having me. My name is Jamie Almandoz. I'm an associate professor of medicine at UT Southwestern in Dallas, where I'm also a medical director of the Weight Wellness Obesity Medicine program.
Wow. So tell me a little bit about what the weight wellness and obesity medicine program entails.
Sure, we're a multidisciplinary clinic. Involves obesity medicine trained physicians. Some of us are endocrinologists, others are internists or family medicine doctors, and we also work with nurse practitioners, physician assistants, and registered dietitians.
hmm And what type of population do you mostly serve there? Are there specific demographics that are overrepresented, or how do people end up there?
We are a part of an academic medical center where, like with most academic centers, there are challenges with access. So we see people who are at the kind of the more severe end of the obesity spectrum in terms of obesity-related complications. Many of our new internal referrals will be on a wait list for a transplant, but can't be listed because of high BMI, or they may be experiencing significant complications of bariatric surgery.
Mm. So, here at the conference, you've been part of some interesting talks and conversations. Tell me a little bit about those.
One of the sessions I spoke in was about the use of medications for obesity after bariatric surgery. And on one hand, bariatric surgery is a really effective but underutilized tool for treating obesity. If we imagine that 1 in 10 people in the US is now living with a BMI over 40, which was one of the criteria for bariatric surgery, and less than 1% of people who are eligible undergo bariatric surgery. That being said, about a quarter million of people in the US undergo bariatric surgery every year, so there's still a significant proportion of people.
Mm,
What's important to note is even though it's really effective, it's not curative for obesity, which means that all those people who've undergone surgery are at risk for weight recurrence or weight regain.
mm,
And there are a lot of health benefits to bariatric surgery, and many of them are associated with the magnitude of weight loss, which means that when we experience weight recurrence, we also are at risk for recurrent disease.
mm. How do people end up kind of on the road to bariatric surgery? Is there a trend towards over recommending or under recommending?
I would say we're in a current situation since the advent of highly effective obesity medications where there is kind of less of a flow towards bariatric surgery. There are lots of reports that bariatric surgery volumes are down significantly in the last 2 years just because people see this as a less appealing alternative to medical therapies.
How does the average person kind of end up on the road to bariatric surgery? What's the process like, and what's the evaluation?
Typically, they'll either be referred into a bariatric surgery center or they can self refer in. Different insurance companies will require different kinds of approvals. Usually, they will require something like 3 visits with the bariatric surgery team and the registered dietitian there. Many programs will require additional testing, including an upper GI endoscopy. Centers of excellence are required to do psychological screening, so patients will often see a psychologist as part of it as well.